Hi, my name is Kayla Foster, and I'll be talking about body dysmorphic disorder. So, what is body dysmorphic disorder? Body dysmorphic disorder is when one person focuses more on their flaws that they think that they may have that others may not even see or even notice. This can make people feel embarrassed and very anxious, which can cause them to keep themselves from going out to like social events or even hanging out with their friends. People with this disorder seek reassurance and constantly look at themselves in the mirror or groom themselves to ensure they look good, or to make them think that they don't look how they think they look, if that makes sense. So basically, they will touch their hair, or fix their hair, or fix their clothing, stuff like that. Some symptoms are that they strongly believe that they have a defect on their appearance that makes them think that they're either ugly or that their face isn't normal. So it's abnormal. They act as perfectionists so that they think that everything is perfect. And they think that people are judging themselves and how they look, and they either will mock or tease someone, or that's what they think. They think that if they walk past a group of people and they look at them, they're oh, they're saying something bad about me, about something. Or if they have one flaw in particular, they're oh, they saw that, so that's what they're talking about. They like to compare themselves to others. So I know a lot of girls or even guys like to compare themselves to models or bodybuilders and be oh, I wish I looked like that. And then people also get cosmetic procedures, so Botox or implants or injections to make their face look different, or different parts of their body different, just depending on what flaws they don't like about themselves. And then also seeking reassurance from others. So people are saying oh, am I ugly? Do I look good today? Does this look good? Stuff like that. So some common areas that people could have this disorder or have areas that they think are their flaws could be their nose, oh, it's too big, it's too small, maybe it's long, it has maybe a bump right here, it's not flat, it's not that little perfect nose that people think exists. Skin complexion, so acne, blemishes, scars, wrinkles. Hair can even be it. It could be people will think that their hair is too thick or too thin. Maybe it's too poofy or too flat. Maybe that people don't like their hair when it's super curly, or maybe that's their natural hair and they don't like it. Or people curl their hair because they don't like how it looks flat. People can also be very conscious about their veins. And then muscle size, which is mostly in males, because they're oh, my muscles aren't too big, I look too skinny, stuff like that. And then also body fat, so it's oh, I have too much body fat in this area, stuff like that. So some issues and problems is this disorder really can take a toll on people and make them focus more on the negative that they think that they have more than the positive of what they have, which can affect their mental health. This can cause people to become suicidal and have thoughts of hurting themselves because they don't think that they are accepted for how they look or they don't fit in. These bad thoughts that other people are thinking, when in reality it's themselves who are making that a problem. So most of the time people don't really notice a lot of things, appearances, but sometimes they'll think that people are oh, they think this because I have this. Does that make sense? Kind of. And then people people can increase their anxiety because they are constantly worried about how they look when they're out in public and wondering what people think about them. Like, they don't want to walk past a group of people and then see that they're like laughing about something and they'll be thinking like, oh, they're laughing at me, but in reality they could be just laughing about something else, and it just happened at a coincidental time. So some causes and risk factors. Serotonin, which is a it's a chemical that's inside of your brain. It's an abnormal for this disorder. People can have an abnormal brain function or abnormal levels of serotonin. And then family history as well. People can, in the past, have this disorder that's within the family, and then it can just be passed along. So kind of like a genetic. Childhood trauma. It can come from bullying or being neglected or abused as a child, either from family or loved ones or even friends, stuff like that. This starts mostly in the early teens, which can happen in both male and female. So it kind of happens at a younger age, but also a little older, so that when people are more brain developed, so that they can figure out what's surrounding them and like what's going on and kind of read a situation. Societal pressure and expectations, so basically setting standards for what people think, which causes a bunch of pressure, because they think that, oh, I have to live up to these standards or else like I don't fit in. And then this can also cause a lot of anxiety and depression. Do other disorders play a role? Major depression and mood disorders, so like bipolar or hypomania, suicidal thoughts and behaviors, OCD, so people want to keep things tidy and clean, germ-free, and basically like the perfectionism. Social phobia and isolation, so keeping themselves from wanting to go out and interact with other people. Eating disorders, like anorexia or bulimia. So anorexia is when people don't eat, and bulimia is when people eat too much. Substance abuse with alcohol and stuff like that. Physical pain from repeated surgical procedures. Surgical procedures will obviously cause a lot of pain because you're changing something about yourself. So causing pain to make them fit the beauty standard. And then skin picking, so like acne and stuff like that. And then lack of self-esteem and confidence. Some treatment is, first of all, to seek medical professional help. So going to therapy, like cognitive behavioral therapy. This can help people learn how to navigate thoughts, or how to learn how negative thoughts or emotional reactions maintain over time. So hopefully that they can, when they're thinking something, that they can put a stop to it. Learning a more flexible way of thinking when it comes to body image. So when someone is focused on one thing, maybe thinking more outside of it so that they're not focused on that one part. Encouraging one to participate in social events or activities, so basically getting them outside of their shell and learning how to be more interactive with others. And then medication, they can put them on selective serotonin reuptake inhibitors, which basically creates that serotonin that they're missing that could be a part of the reason why they're having this kind of disorder. And then if it's to a drastic point where none of that has helped, they could be hospitalized and may need to have some more severe psychiatric attention, which is what they can get in that hospital, and make sure that they're not causing harm to themselves or others. And then that's it. Thank you.